Hi students, and welcome to our discussion of forensic questions of NEET PG 2020. Okay, um, so let's take up our first question, and remember these are all recall questions as submitted by you all. Uh, so first question is a picture based question which says, which of the following test shows yellow needle shaped crystals of spermine picrate, and probably a picture is shown or was shown in the examination. So let's try and talk about this question. When we talk about this question, basically we are talking about evidences which may be found at crime site in a very minute quantity. Commonly we call these evidences as trace evidences. So when we talk about trace evidences, there are two very important biological specimens that we need to talk about. They are blood and semen. Blood in trace quantities can be found at homicidal crime sites, and semen can be found at sexual offences or sexual crime site. Now, whenever these evidences in trace elements or trace quantities are found at crime site, uh, the primary objective is to identify them either as blood or semen, and when the investigators pick up these samples from an alleged crime site and they are sent to forensic science laboratory for analysis, forensic science laboratory go through series of investigatory methodologies to identify the alleged sample either as blood or semen. In those variety of tests which are available, there are four very important microscopic identification, two for blood and two for semen. The question is based upon that microscopic appearance. For blood, the two important microscopic tests are Teekman's test and Takayama test. Okay, Teekman's test and Takayama test for blood, and for semen we have Florence test and Barberio's test. All of them required slides to be prepared from the alleged sample, and then those slides are watched microscopically, and if characters are found on that microscopic examination which are as described in the test, then we can say that probably the slide is either a blood or a seminal sample. So in Teekman's test, the crystals which are generated for microscopic appearance, they are brown in color, rhombic in appearance, and they are crystals of Hemin chloride. Okay. In Takayama, the crystals which are generated are pink in color, feathery in appearance, and they are crystals of hemochromogen. Okay. Whereas if we talk about semen, in Florence test, the crystals which are generated are again brown in color, and they are also rhombic in appearance. They are called crystals of choline iodide. Okay. The difference between the crystals of Florence and Teakmans, because as you can see in Teakmans also we have brown and rhombic crystals which are basically hemin, hemin chloride crystals, whereas in Florence we also have brown and rhombic, but they are crystals of choline iodide. The difference between these two crystals are the crystals in Florence test are bigger in appearance, so their size is very big as compared to Teakman's crystals, and they are arranged either as pluses or crosses. So, their arrangement is either as plus or cross. Okay, that is their identifying features. Whereas in Barberio's test, we have crystals which are yellow in color, needle shaped crystals. They are crystals of spermine picrate. They are crystals of spermine picrate, and that was exactly what was asked in the examination. So, if we go back to our question, what we see that the question says there are development of yellow needle shaped crystals of spermine picrate. What would be the name of the test? The name of the test would be Barberio's test. Okay. Okay, let's move to our next question, that is question number 2. Question number 2 is the most widely used substance dependence drug is. Okay. Before answering the question, which is fairly very out of the given choices, the answer is very easy. Let's talk a little about substance dependence. So, whenever we say drug dependence, we are talking about two concepts of drug dependence. It could be drug habituation or drug addiction. The basic difference between the two is more or less the physical dependency that these cause. Drug habituation commonly leads to psychological dependence, and emotional dependence. Whereas if we talk about drug addiction, the hallmark of addiction is physical dependence. It also, though, involves psychological and emotional. Okay. Now, when we talk about uh, drug dependence, there are basically 7 types of drug dependencies that we talk about. Uh, One is morphine type, second is barbiturate type, third is cocaine type, fourth is cannabis type, fifth is amphetamine type, sixth is khat type, and seventh is hallucinogens type. Although this classification is not very well accepted, but this classification is being circulated into the academic world. Okay. Now, of the various studies recently conducted worldwide also, and within the region of independent countries, what has been found, uh, the agents which are most commonly used for uh, dependence, whether habituation or addiction, uh, their frequency is nicotine, or you can say cigarettes, okay, or tobacco, followed by alcohol, followed by cannabis, followed by painkillers, followed by cocaine, which is further followed by heroin, which is followed by benzodiazepines, and lastly, because of the scarcity of the space, I am writing it on the top, and lastly are stimulants. So, this we would say uh, is more or less the percentage of people in decreasing frequency from highest to lowest are uh, about the drug which is being used by most people for any kind of addiction. So, like coming back to our question, uh, the answer becomes very simple, that out of the four given choices, the most widely used substance uh, used for drug dependence or dependence drug is option number A, cannabis. Let us move to our third question. Again, it is a picture based question where an X-ray is shown. Uh, the question is, as per POXO Act, POSCO Act is Prevention of Children Against Sexual Offences Act. A child was brought for age examination, uh, an X-ray wrist was taken. The maximum age of the child according to the X-ray is, the options are 4 years, 7 years, 10 years or 13 days. Okay. And an X-ray wrist picture has been shown. Now, depending upon this picture or any time when we look into the X-ray picture of a wrist, there are three important areas in that X-ray to look for. Okay, three important areas to look for in an X-ray wrist. The first is lower end of radius and ulna. Okay, lower end of radius and ulna. So, if I were to draw, let us say this is radius and let us say this is ulna. Okay, the lower end of radius is this. Okay, so this is the lower end. The lower end of radius comes at age of 2 years, whereas the upper end comes at 5. The lower end of ulna comes at 6 years and the upper end at 9. So, what do we see in lower and upper end of radius and ulna respectively, that the age of appearance of the lower end or the upper end of radius and ulna, there is a gap of 3 years. Lower end of radius 2, so upper end comes at 5. Lower end of ulna comes at 6, so upper end comes at 9. So, there is a gap of 3 years in the appearance of lower end radius and ulna both. So, this is all about appearance. Appearance of center of ossification for lower end of radius or ulna. How about their fusion? Okay. Now in wrist joint there is a participation of lower end of radius and ulna, because the shaft of the radius and ulna fuses with their styloid. For ulna, the shaft of the ulna fuses with its styloid, that is the lower end of ulna, at the age of 18 years, and radius slightly later than that, that is around 19 years. Okay. So that is the first thing to be seen uh, in an X-ray of wrist joint. The second thing to be seen in the X-ray of a wrist joint are carpal bones. Okay. The second to be seen are the number of carpal bones which may be present. Okay. The first two carpal bones which comes into the hand are capitate and hamate, which comes at 2 months and 3 months respectively, followed by triquetral, which comes at 3 years, followed by lunate, which comes at 4 years, followed by scaphoid, which comes at again 4 to 5 years, followed by trapezium, which comes at around 4 to 5 years again, followed by trapezoid, which comes slightly later than trapezium, so around 5 to 6 years, followed by pisiform, which is the last carpal bone to arise in hand. And the age range of arrival of pisiform is 9 to 12 years. Okay. So if we look at the sequence of arrival of carpal bones into the hand, what we can say is at the age of 1 we have presence of 2 carpal bones in the hand. At the age of 2 we still have 2. At the age of 3 we have 3. At the age of 4 we have 4. At the age of 5 we have 6, because scaphoid and trapezium, as you can see in the list, they come at around 5 years of age. At the age of 6 we have 7, and the eighth carpal bone, which is pisiform, we might have it at the earliest of the age of 9. The range is 9 to 12, as you just saw in the description. That's the second thing to look for in X-ray of a wrist. The third thing, the third thing to look for is the union of the shaft of first metacarpal with its head. Now we are only talking about the union of the first metacarpal. Okay, so we are talking about the metacarpal which is present in the thumb. This union happens at the age of 15 years. So if the first metacarpal's head or the base is united with its shaft, so there is no epiphyseal gap there, we would say that the person is more than 15, and if the union has not yet happened, we would say that the person is less than 15 years of age. With all this knowledge, let's come back to our picture now. So what we see in this photograph is that the lower end of radius has come, which means which arises at 2 years of age. So definitely the child is more than 2. The lower end of ulna has also come, which means that the person is greater than 6 years of age also. And then if we focus our attention to the carpal, we can see the presence of all the 8 carpals there. So we have scaphoid, lunate, triquetral, and what we see here, okay, is the pisiform bone sitting onto the head of triquetrium. Okay, and then we can see the 4 other uh, carpals also in the second line. Fine, which means because pisiform is seen, the person has to be greater than 9 years. And if you see the base of the first metacarpal hair, it is not fused with the shaft of the metacarpal, which means that the child is less than 15. So according to this X-ray, we would say the best we can say by looking at this X-ray is that the child is somewhere between 9 and 15, and out of that, uh, you know, the maximum age which we can say that this person might have is the age of 10. Okay, the maximum age could be the age of 10 because of the presence of pisiform in the given X-ray. Please understand that this X-ray has been recreated uh, depending upon the recollection of the students in the main examination or in any other subsequent examination. If we change the X-ray where a pisiform may not be present, then the age which could be the maximum age may decrease down to 7. And if we still change the X-ray where the first metacarpal, the shaft of it has been fused with the base, the age may be more than 15 also. So depending upon what has been shown in the given X-ray, the ages may vary. What every student has to stick is to develop a habit of identifying these three areas that we just talked about, which are the more important three areas to look for in a wrist X-ray. One is lower end of radius and ulna, second is the number of carpal bones which are present in the X-ray, and third is the metacarpal fusion. Okay, first only. Okay, let's move to our next question, that is question number 4, and the question is: in the court of law, the act of witness giving false evidence after taking oath is punishable under. This is a very common and a often repeated question. Uh, this question basically is talking about what is called as perjury, which is basically an offense. And what exactly is perjury? Perjury is uh, in the court of law, while a witness is giving an evidence and the witness is under oath, because every witness which moves to court of law is under oath to deliver the truth, and under oath, when a witness in the court of law gives a false evidence, which means the witness lies, that offense is called as perjury. And because it is an offense, it has to be defined in the Indian Penal Code, and the definition of this offense is given in section 191 of IPC, and the definition is what I said just now. What does section 191 of IPC say? It says that in the court of law, while giving evidence, a witness who is under oath, if he gives a false evidence, which means he lies about his evidencing, that act is called as perjury. And now, because it is an offense, it has to have a punishment, and the punishment is given in section 193 of IPC, which says that an act of perjury can attract a imprisonment of up to 7 years of imprisonment or fine or both. Okay. So, the punishment is given in 193, the definition is given in 191. So, in the current question, the question is that the act would be punishable under, and the correct option would be 193. Please do remember that this is a very often asked question in various examinations previously, and it is still a question which has been asked again and again. Let us move to our question number 5. Again, it is a picture based question where the picture has been shown, and the question is identify the phenomenon. In this picture, we can see a photograph of a body which has if you can see certain discoloration onto the body. If you see the cleanly, we can see green discoloration on the body. What else we can see? If you look at the picture closely, here we can see greenish lines on the body also, which are showing marbling. And of course, we can see blisters which are present on the body. Now, actually the presence of blisters onto the body uh, can be a phenomena of scalds, which is basically wet burns. Uh, they can be present onto the body in cases of barbiturate intoxication, which are called as, very commonly called as, barbiturate blisters. They can be seen in carbon monoxide poisoning also. Okay, but because as we see in the picture, there is greenish discoloration and signs of marbling onto the body. This is very very simple. Basically, it's a dead body which is being decomposing, and these blisters are nothing but blisters of post-mortem change. Okay, so we have post-mortem blisters onto the body also, and thus we can safely say that the current phenomena is phenomena of putrefaction, which is basically post-mortem decomposition of the body. Okay, so picture basically shows post-mortem decomposition, and one of the ways in which body decompose is putrefaction. Okay, so the phenomena is putrefaction as shown in the picture. Let's move to our next question, which is question number 6, and the question is, the onus of proof in civil negligence case against a doctor lies with. Okay, so let's talk about what exactly is onus of proof. The onus of proof means the burden of proof, also known as the liability of proving. See, whenever a case comes to the court of law for uh, the court of law to make a declaration or an to solve the matter in the court of law, what is talked about is whose liability is it to prove the allegation. Okay, you can remember like that. The onus of proof is liability to prove the allegation. Okay, now in a case of civil negligence, there are two parties. Okay, in fact, in any civil case there has to be two parties. Also in a criminal case there has to be two parties. If there are no two parties, uh, the law cannot act, the court has no reason to intervene. So in a case of two civil negligence, the two parties are plaintiff. Who is plaintiff? In civil cases, plaintiff is the name given to the party or to the person who alleges the charge, and the second party is defense or defendant. Defendant is who? On whom the charges are being alleged. So who is plaintiff in a civil negligence case? Plaintiff is the patient, because patient has come to the court of law alleging that a particular doctor has been negligent in his treatment. Okay, that is why he has come to the court of law, because he wants compensation for his suffering because of the alleged negligence by the treating doctor. And who is defense? Defense has to be the doctor. Okay. Now, once we understand this scheme of things in the court of law, then everything becomes easy. Now, what do you think that when a patient has come to the court of law seeking compensation for his suffering because he alleges that the doctor from whom he was getting the treatment has been negligent in his approach, then the patient only has to prove the negligence of the doctor. If the patient succeeds in proving the negligence of the doctor, the court may allow a compensation to be given to him, the amount of which shall be decided by the court. If the patient does not succeed in proving the negligence of the doctor, then patient would not get anything. So, in this case, the doctor does not have to prove anything. Okay, it is the burden of the patient that he has to prove that a doctor has been negligent in his treatment by bringing variety of evidences in his support, and if those evidences are accepted by the court of law, the court of law may decide what compensation needs to be given to the patient uh, you know uh, for his suffering because of the negligence of the doctor, and that compensation amount will further be paid by the doctor if the patient succeed in proving his allegation. And so, if we come back to our question, the answer becomes really simple. The answer is, it is the onus of patient in a civil negligence case to prove the civil negligence against a doctor. Let us move to our next question, question number 7. The poison commonly detected in exhumed body is, this again is a very old question, and the answer I would like to share the answer first, which is basically arsenic. Okay. Now, arsenic has a very peculiar tendency it gets deposited preferentially in bone, nails and hair. Okay. So, there is a preferential deposition of arsenic in bone, nails and hair, and as a result, uh, if a person has been intoxicated with arsenic and the body has been buried, even if it has remained buried for a number of years, where the flesh and the muscles and tendons of the body may have been decomposed, only bones are remaining. Even if you exhume that body out and the skeletal remains are found, those skeletal remains can still show high amount of arsenic, and thus we say that a person who has been intoxicated with arsenic, uh, arsenic levels can still be detected after a number of years in exhumed skeletal remains. Okay, next is again a very common question, that is, Magnon symptom are seen in. Okay, Magnon symptoms are symptoms of formication. Basically, The person experiences insects crawling under the skin. Okay, they are psychological phenomena. There is nothing actually that there are insects under the skin. Okay, they are symptoms of formication. They are psychological phenomena where a person scratches his body because he feels that there are insects which are crawling under the skin. The name is given as Magnan symptoms, which is seen in cocaine abuse. Okay, so they are correlated with cocaine always. Question number 9. Coming back, one more thing uh, to question number 8, that they are also called as cocaine bugs. Okay, because as I just said, they are symptoms of the patient complaining that there are certain insects which are crawling under the skin. So they are often referred to as cocaine bugs also. That's Magnan symptoms. Okay, question number 9. A tattoo is not visible on autopsy, uh, but the presence of tattoo was informed by a relative. What is the next site to check? And the tattoos that we talk about are basically what? Tattoos are imprint of ink preparations which are injected subdermally. Okay. So this is nothing but uh, ink being injected subdermally, either to write a name or to form a shape by a special tattoo needle. Um and over a period of time, this ink preparation which has been injected subdermally, the ink is drained by the regional lymph node. So if for some reason the tattoo which was visible onto the skin surface cannot be seen because it has been mutilated, or because of high decomposition of the body, or the local area has got burnt, but uh, there are strong allegation that a particular tattoo was present there. To check the confirmation of the presence of tattoo in that area, what needs to be looked for is local lymph node presence of ink stains or spots in that local lymph node draining that area. Okay, question number 10. On voluntary admission, the maximum number of days a person can be admitted as per Mental Health Act is uh, Mental Health Act came in India in 1987, and this act talks about the civil responsibility of a citizen of India. One of the areas of this act which it addresses is the admission of a person into a psychiatric nursing home or a psychiatric hospital as an inpatient for primary diagnosis of his illness. Okay, if a person thinks that he might have a psychiatric illness and he wants to be admitted because he has been prescribed by a psychiatrist that you have to be in observation for certain number of days so that a psychiatrist can observe you and then comment about your diagnosis. This is one way, what we call as a voluntary admission. The person voluntarily approaches a psychiatric hospital for admission for his primary diagnosis of his illness, whether he has it or not. Now, whenever a voluntary admission comes like that, uh, so voluntary request for admission, the doctor has 10 days for making the diagnosis. For some reason, if the doctor does not or is unable to make a diagnosis within 10 days of voluntary admission, can the doctor extend the period of stay of the patient? Yes, by permission of magistrate, the doctor may get 10 more days to complete the diagnosis. If the doctor does not complete the diagnosis still, can he still keep the patient in the hospital? Yes, there is a provision. Again, by the permission of magistrate, a doctor may get 10 more days for his diagnosis. So, in this way, a doctor may get a total of 30 days to make his diagnosis. Okay. So, whenever a person who comes to a psychiatric hospital and makes a voluntary request for admission, the doctor has 10 days to admit him and diagnose him. If the doctor is or has if the doctor has failed to complete his diagnosis in that 10 days, what the doctor needs to do is to write to the local area magistrate and gain his permission to keep the patient for 10 more days. Magistrates have power to grant an extension of 10 days. After completion of 20 days like that, if the doctor has still not been able to make the diagnosis, the doctor again has to write seeking extension of the patient in the hospital. The magistrates have again the power to give an extension of 10 more days, but beyond that even magistrates can't help. So, thus a doctor has cumulatively a maximum of 30 days to keep the patient in a psychiatric restrained facility for making his primary diagnosis, failing which he cannot restrain the patient anymore. He has to let the patient go or he has to set the patient out. So, if we come back to our question, the question was on voluntary admission, the maximum number of days a person can be admitted as per a mental health care act is, the answer is 30 days. Okay, the answer is 30 days. So, that takes care of the talk about the NEET recall questions. We had 10 in total. I hope your examination went well, and yeah, for those students who are still preparing for 2021 examination, Best of luck. Maybe this discussion will help you all, and we'll keep meeting in our further interactions, where we'll keep discussing further questions which will be coming in our grand tests and any other test that you may attempt. Till that time, bye bye and study hard.